Are you that person who, when they are asked, have you tried acupuncture? You've said, oh, yeah. I tried it once. It didn't work. Or maybe you're that person who was like, yeah, I tried acupuncture, but I didn't feel anything. Or you could also be that third person who maybe you did try acupuncture, but it hurt. So why is that? Why is it that everybody has completely different experiences? Let me tell you about it. There are a lot of different styles of acupuncture, and they were derived in different areas. They are good for different people and different constitutions, and they might treat different diagnoses. So, before you go into acupuncture, I do highly recommend that you do check out the reviews. I think it's important to have a referral, if anything. And then I would also see how long they've been in business. See if they have a specialty, and then see whether that aligns with what you're looking for. So there are a lot of different styles of acupuncture, but then there are also different specialties. Just like biomedical medicine, you have primary care providers, but then you also have specialists, and you wouldn't go to an orthopedist wanting to do fertility. You would go to an endocrinologist. So they all probably have some real basics on the knowledge, but they specialized in those types of medicine. So believe it or not, that's the truth for acupuncture as well. All of us are trained in a basic primary care provider style. In fact, in some states, acupuncturists can be primary care providers. They actually do learn about lab work. They can order lab work. They can look at your lab work, and then they can refer out in case they feel that's necessary. But in some states, that's not the case. But I will say that many traditional providers are primary care, and they don't necessarily specialize. So when you're going in and you know for a fact, I specifically want to be working on fertility, you're going to want to find someone that has a board specialty in reproductive endocrinology. And you want to find out those people, if any, in your area, first of all. Secondly, you're going to want to learn the different styles of acupuncture. So there are some styles that are very light, and they are for people that have lots of inflammation. Sometimes they're very good for pediatrics, and that would be a Japanese style. And most providers do have a variety and the ability to change the strength of their needling techniques. But I will say overall, Japanese style is going to be very light. They're very, 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 very thin, tiny little needles, and sometimes they don't even fully penetrate the skin. And you can also do moxa, which is they do moxa on the skin that you light, and it warms on the skin, but it doesn't necessarily use a needle. There's also acupressure in that regard for their Japanese style that's often used for abdominal massages, etc. And that might be a good style if you are very nervous about feeling the needles and you are nervous about your pain threshold. This is good for fibromyalgia patients, etc. Now, some people, like an athlete, might really want to feel something. And that's that second person who went in and they laid down and they said, I didn't feel anything. Those people are expecting to feel something when they are experiencing it, and they're expecting to feel something right away. So I will say that Japanese style probably would not be the best thing for you. Then you would want to switch gears and get more into what we would call a motor point or trigger point therapy. This is where they use the channel therapy, traditional Chinese meridian therapy, but then they also use trigger point, where they actually go into the muscle and reset the muscle, where you'll feel it vesiculate or release. And that immediately will give some relief if the only issue is a locked misalignment and a locked muscle, and that could be very helpful. It's a very strong style of acupuncture, In fact, they also use electric stimulation sometimes, where they put stimulation onto the needles directly. You see that in PT. Sometimes they have little pads that they put on the skin, and people have used that at home, and it's called a TENS unit. That is similar to that, but this is actually connected to the needle, which goes into the muscle and right near the action potential point of the muscle to fire it, and it will cause the muscle to contract or jump or release, however you want to put that. So that is if you are an athlete or if you're someone where you want to feel the experience. And then you also have your more traditional style acupuncture, which is what I do. I do traditional Chinese medicine theory as well as that style, as well as the motor point and trigger point as needed. So what's going to happen with that is that you should not feel much of anything going in. With technique, it should be pretty smooth, and it should be going past the superficial layer of the skin that causes those nerve endings to fire. So you should go past that. You won't feel anything but maybe a tap, and then you will feel with a little bit of an articulation of the needle, something called de qi. In traditional medicine, we are searching for de qi, which is like the right qi, the right spot. It's where it's like beckons this blood flow. It's what you want to feel, a little bit of an achiness or maybe a release, a feeling. That's what you would be looking for in regards to traditional Chinese medicine. It won't be painful, but it is very unique, and it's different for most people when they've never experienced that before. So you're going to want to do your research in your style of acupuncture. There's also something called 5 elements, which is a style that is very specific and specialized. And you need many years to kind of hone in on this method. And they really just use maybe 4 needles for those of you that are also very nervous about needles and you rather just have a handful of needles. Then that is 5 element. And they'll have one channel that has an entry point and then the exit point of that channel, and then the same thing with a second channel where you'll get a little release at the one point of the entry and another release at the exit point of that channel. And it really is almost a kind of catch and release, I like to call, where you would put the needle in, you feel that little de qi response, you feel a little shift, and that's it. And then they take it out and they don't stay in at all. Just so you know, when you are looking to choose your acupuncturist, you want to make sure that you do check their reviews. Referrals are the best in this situation, I find. And you want to check their history. You want to obviously make sure they're licensed. Make sure that they have a specialty if you are looking for a specialty. And then you want to know what style they do. And there's a difference between Japanese and traditional Chinese, and there's 5 element style, and there's motor point, trigger point. So there's many different other that I'm sure I'm not addressing, but these are just the major ones offhand that you will experience. So I hope that helps when you are thinking about why acupuncture didn't work for you. The final thing that I also wanted to mention is don't think this is going to happen in one visit. So the way that this usually works is, yes, you should have some relief. I find with my patients there should be some change between when you came in and when you left if you're coming in for pain. If you're coming in for something chronic or systemic, when I say systemic, I mean something underlying, hormonal issues or digestive issues, sleep issues, anxiety issues, those sort of things that are not structural, those are going to take some time. And depending on what you're coming in for, if it is a chronic issue and it's been something that has taken you months and years to get here, it might take you a few months to get out of this position. However, I do believe that you will get some relief and you should have some changes in your lifestyle and in your quality of life, and there should be some changes within, I would say, 5 treatments. So I usually would say to people, at least commit to 5 or 6 treatments and then reassess and see how you feel. If you are coming in for fertility, I do that myself. That's one of my specialties. I always say, rule of thumb, it takes at least 3 months because it takes at least 3 months to change egg quality or sperm quality. So just understanding how this medicine works, it's not always a one and done. The goal is to treat the root and the branch, and the root is the underlying issue. So if you just treat the branch temporarily, that's going to fall back and it's not going to stay in that position or place, and you're not going to stay well. And so the goal with this medicine, again, is it's all inclusive, is to get you in alignment. Internally will affect the external and vice versa. So I would not expect you to come in and have just one. It can happen. It's been known to happen. I've had people come in and have one visit and magical miracles can happen. But I would say, as a rule of thumb, that you would want to basically have about 5 treatments to know that's the basic of making some major changes.
Thank you for listening and being a part of the conversation today. If you enjoyed it, please like us or leave a comment in the comment section. We would love your feedback, and we are open to topics that you would like to discuss. And better yet, if you know anyone that may benefit from this information, either they're suffering, they're in pain, or they're just curious about trying this medicine but they don't like needles, please share this podcast. As I always say, wellness is as contagious as the flu.